This is part 2 of chapter 5 for Nutrition 230, the lipids chapter. So now we're going to talk about triglyceride energy production. Triglycerides can be used to be converted to energy, or ATP, through the citric acid cycle and electron transport chain. Lipids are only used in aerobic metabolism, or in the presence of oxygen. And lipids are used at a higher ratio the lower metabolism is going at. So the more heavily you're exercising, the more anaerobic metabolism and higher carbohydrate concentration you're using. And when you're just sleeping, you're pretty much only metabolizing fat. So fatty acids are going to be converted to acetyl-CoA, which then transfer through the citric acid cycle and the electron transport chain, creating water and ATP. In addition, we have glycerol, which can be converted to glucose through gluconeogenesis, or to pyruvate, which then in turn is converted to acetyl-CoA. When we look at acetyl-CoA, we can see here that palmitic acid is a fatty acid plus 8 CoAs is going to be converted to 8 acetyl-CoAs. This then can be a highly efficient energy source to enter the citric acid cycle, as you saw on the previous page. When we're feasting or excess energy is consumed, we don't really need to make too much more ATP, and we need somewhere for that excess 9 calories per gram to go. Therefore, the lipids are stored as triglycerides in adipose tissue. We have pretty much unlimited capacity to store lipids in adipose tissue. When we're fasting or no food has been eaten for a while, triglycerides from adipose tissue are broken down, and then fatty acids can be used for energy. So converted to acetyl-CoA, citric acid cycle, electron transport chain, and ATP would be the final product there. Lipids are associated with cardiovascular disease, which is the most common cause of morbidity and mortality in the United States. Over 83 million Americans suffer from some form of cardiovascular disease. Studies show that cardiovascular disease both has a genetic component as well as a diet and lifestyle component. So diet and lifestyle really do affect the risk of developing cardiovascular disease. Atherosclerosis, which we'll talk about on the next slide, it is a disease in which lipids and fibrous material are deposited into the artery walls. So let's take a look at the development of atherosclerosis. In a normal artery, the wall is lined with a layer of epithelial cells that are surrounded by smooth muscle. So you can see this in number 1. It's very clear and clean there, and there's a lot of space for blood to transport through. Damage to the lining of an artery causes inflammation and begins the process of plaque formation. The injury attracts white blood cells, which mature into macrophages, and this makes the lining more permeable to LDL particles. Inside the artery wall, LDL becomes oxidized and then forms oxidized LDL cholesterol. Inside the artery wall, the macrophages fill up with oxidized LDL cholesterol and then are transformed into what we call foam cells. These cells get so full that they burst, depositing cholesterol. The accumulation of cholesterol and proteins forms a plaque, which we can see in this number 4. As the inflammation continues, the plaque builds up, causing the artery to narrow and lose its elasticity. A cap of smooth muscle cells, as you can see here, this fibrous cap, will wall it off from the lumen of the artery. However, there's danger of that fibrous cap rupturing. Blood clots can rapidly form around it if the cap ruptures or erodes. The blood clots can completely block the artery at that spot or break loose and block an artery from elsewhere. If this happens near the heart, it could be a heart attack, and if it happens in the brain, it could be a stroke. There are a number of factors that affect our risk for atherosclerosis and affect our risk for heart disease overall. Age and gender, of course, are things that we can't control so easily, but we can control overweight and obesity, smoking, diet, and activity. We can't necessarily control our genetic background, and blood lipid levels and high blood pressure have both a genetic effect and a lifestyle effect. When we look at optimal blood lipid levels to prevent cardiovascular disease, we want our total cholesterol to be less than 200 milligrams per deciliter, LDL cholesterol to be less than 100 or less than 70 in people who have high risk of cardiovascular disease, HDL greater than or equal to 60 milligrams per deciliter, and triglycerides less than 150 milligrams per deciliter. We can implement some dietary interventions to reduce our risk of cardiovascular disease. And as you all become dietitians, you might be working with a lot of patients who have suffered from cardiovascular disease or who are at risk. First off, focus on whole foods, mostly polyunsaturated, especially omega-3 fatty acids, as well as monounsaturated fats. Focus on plant foods that are high in soluble fiber, B vitamins from some of those plant foods, antioxidant-rich foods that include vitamins A, C, and E. Moderate alcohol consumption as well has been shown to decrease the risk of cardiovascular disease. That would be 1 drink a day for females and 2 for males. So you can see here, you could create a pretty delicious diet in order to reduce your risk of cardiovascular disease. You can add some antioxidants by having some red wine and some dark chocolate along with your fruits and vegetables. You can go a little bit leaner with your calcium-rich foods in terms of lower fat, cheeses, and dairy. You can make sure to have whole grains and make sure some of your protein sources come from salmon and some of your protein and fat sources come from nuts. There are other factors that increase risk, such as cholesterol intake, which, as I mentioned, has been removed from the dietary guidelines. So foods that are high in cholesterol but aren't high in saturated fat, such as shrimp and eggs, aren't as much of a risk factor anymore. Saturated fat, trans fat, high sodium intake, excess sugar intake, and excess energy intake can all increase the risk of cardiovascular disease. The Mediterranean diet is a diet that's higher in fat than is recommended in the US. Typical Mediterranean diet consumption is about 40% of total calories from fat, as well as red wine in moderation. Sometimes you'll even see on a Mediterranean diet pyramid that olive oil is actually a whole food group. But you can see here that meats and sweets are eaten less often, and poultry and eggs even are eaten in moderation. Physical activity is also on this diet pyramid, and people who consume the Mediterranean diet pyramid have one of the lowest risks of cardiovascular disease of anyone in the world. So when we look at the risk factor and heart disease, we can see that there are a variety of components that will affect heart disease. Age. The risk of heart disease is increased in men aged 45 or older and in women 55 or older. This is because estrogen has a protective effect against cardiovascular disease, so women are protected until menopause. In terms of gender, as you can see, women have an effect a little bit later in life, but both have equal risk of cardiovascular disease. Genetic background, if an individual has a male family member who showed signs of heart disease before 55 or a female family member who showed signs of heart disease before 65, they're considered at increased risk. In addition, African Americans have a higher risk of heart disease because of their tendency for high blood pressure. And Mexican Americans, Native Americans, and Hawaiians have a higher risk due to incidence of diabetes and obesity. High blood pressure can help damage blood vessels, contributing to atherosclerosis. So a blood pressure of greater than or equal to 140 over 90 millimeters of mercury can be dangerous. Diabetes can contribute to cardiovascular disease because high blood glucose can damage the blood vessel walls, further contributing to atherosclerosis. And obesity, which is defined as a body mass index of over 30, increases blood pressure, blood cholesterol levels, risk of developing diabetes, as well as the amount of work the heart has to do in order to pump blood throughout the body. Blood lipid levels are also going to affect the risk. So when we look at blood lipid levels, high risk would be total cholesterol of greater than 240 milligrams per deciliter, greater than 160 milligrams per deciliter of LDL, and less than 40 milligrams per deciliter of HDL. Smoking will also increase our risk. Physical activity will help decrease risk, and the physical activity that you want to focus on for cardiovascular disease is cardiorespiratory exercises, such as walking, running, things that we think of as more endurance activities. And then a number of dietary factors, which we spoke about already, are going to increase the risk or decrease the risk as well. So we can determine the total calorie intake for the day and then the grams of fat in the day's diet. And from that information, we can calculate energy from fat. Fat provides 9 calories per gram, so we would multiply grams of fat by 9 calories per gram, and then calculate the total percentage of energy from fat by taking the kilocalories from fat, dividing that by total kilocalories, and multiplying that by 100. For instance, if someone consumed 75 grams of fat a day and 2,000 calories, we would multiply 75 grams of fat times 9 calories per gram to get 675 calories from fat. Then we would divide 675 by 2,000 total calories times 100 to get 34% of total calories from fat. We can use the exchange list, which I had mentioned in our last lecture for carbohydrates, as being a joint mission from the American Dietetic Association and American Diabetes Association to estimate fat content. So there are different exchange groups that will have different numbers of fat grams, depending on whether they're labeled in the milk group, non-fat, low-fat, reduced fat, whole fat, or in the meat or meat substitute group, very lean, lean, medium fat, or high fat. Lipid recommendations will increase at certain times of life. So as you can see here, as opposed to the AMDR for adults, which is 20 to 30% of total calories, infants actually need a diet with 40 to 55% of energy as fat to get enough calories for the day. When you see the dietary recommendations to reduce the risk of heart disease, you can see that there are a little bit more strict guidelines than the regular dietary guidelines. So as you can see here, instead of saying less than 10% of calories from saturated fat, it says less than 7% of calories. The total fat recommendation is actually slightly higher than the AMDR because the monounsaturated and polyunsaturated fat recommendations are increased a bit. When we look at fats on the current nutrition label, you can see that we list calories from fat, which of course is going to be our fat grams multiplied by 9 and then rounded to the nearest 5. So 8 times 9 is 72, but then that would be 70 would be the closest rounding by 5 there. When we look at saturated fat, you can see percent daily values are listed for total fat, saturated fat, as well as cholesterol. When we talk about daily values, less than 5% is low and over 20% is high or an excellent source. If the product has less than 0.5 grams of trans fat, the Nutrition Facts panel can list trans fat as 0, even if partially hydrogenated oil is an ingredient. So in order to identify whether there's trans fat, you really need to look in the ingredients list. There are a number of different guidelines for fat on food labels as well. And as you can see here, which you can take a look at in the in your